I'm Alison Kirk. I'm Head of Patient Experience and Involvement at LPT, Leicester Partnership Trust. I have got the privilege of speaking on behalf of Malcolm Heaven, who this submission is written on behalf of. Malcolm is a volunteer with us here at LPT, and our project really that we're going to talk about today doesn't cover one environment of care, but also it describes our approach and how that approach creates environments wherever we do the Need to Chat service. And it offers an opportunity for service users and communities in a safe place where they can feel empowered and supported. So, as I say, I'd like to do Malcolm justice today. He's taken a well-earned rest up in the Lake District, and he's got his legs up, he said, crossed with a glass of wine this afternoon, thinking of us all. So we'll raise a glass to Malcolm later. But I just wanted to open our presentation in the words of Malcolm. And he says, "I'm not a baker, I'm not a medical professional, but I'm going to tell you how baking bread can be good for your health." So next slide, please. So our mantra for our sessions is to be flexible, accessible, and we can and have delivered sessions in a range of places and spaces, from pubs to acute inpatient wards. We look to create an environment which feels safe to learn a new skill while sharing our stories. The making of bread is just the process that we used to facilitate the environment. So really, the baking of bread is secondary. It's actually the stories and the sharing of experience, which is the primary element of this project. And we work within the framework of the 5 ways to well-being. And for those of you that do or do not know, I'll just quickly take you through. So number 1 is around connectivity, creating a safe, relaxed space for people to meet with others, having developed a social network to support and enrich lives. Number 2 is being active, by encouraging connectivity and mobility, providing an opportunity to get up off your feet and use energy in the kneading process. 3 is around taking notice. Baking bread is a mindful activity that gives you time to reflect on what matters to you. And through conversations, we encourage the sharing of stories, experiences and challenges. Number 4 is around keep learning. So it's about learning new skills or rediscovering an enjoyable activity while using dormant skills. Either way, Need to Chat is around having fun and a new way of learning to build new skills and to build your confidence. And the 5th element is around giving. Home-baked breads is a wonderful gift to share. I mean, hopefully you're sharing your cakes today. So to give something you've put time into can make a positive impact on your well-being as well as others. And it is really, really good in terms of helping with good functioning. So we always start our sessions with, you're going to do something today that you're going to be proud of. And that's really our mantra. So slide 3, please. Next slide. So it's not just me. We have a fabulous group of volunteers who work with us to deliver our sessions. One of our volunteers is a former patient of the Trust and has long and enduring mental health issues. But through her attendance at one of our sessions, which was delivered as part of our Recovery College programme, she's now joined us and continues her journey of recovery through running courses for the Recovery College. The smallest session we have run has been with 1 person, and we run with sessions with groups of up to 30. And we run a session in a pub actually around drug and alcohol, ironically, with 30 men in a disused pub. So, you know, flexibility is the key, and it's something that we pride ourselves on. We've baked on acute mental health wards with staff as part of their well-being, and also within the community. We take our steer from those we're baking with, tailoring our approach from sessions of 1 hour to 5 hours, and have worked with a range from learning disability groups to local communities, including working with charities. A really great example here is around one of the projects one of the sessions that we delivered with the disability charity in Memphis. And this is where we worked with a young chap who actually, due to his disability, had to knead with his wrists, and he'd never ever made anything in his life in terms of baking or food. And you know what? He made the most amazing loaf of bread. And he was really, really proud, and sort of the confidence that it gave him in terms of his skills in that day was absolutely a fabulous thing to see. There hasn't been any group yet that we've not been able to bake with, so it is a very, very adaptable and flexible approach. We also have an online community where we can deliver our sessions via Zoom, and this has come into effect really over COVID, as you can imagine. And during this time, we've doubled our online community, which includes both staff and patients. There are, of course, the numbers. But obviously the numbers we submitted as part of our programme was what we've submitted way back in sort of towards the end of last year, beginning of this year. And obviously COVID has hit, but we did reach our 1,000th loaf just at the early stages of COVID hit. And during the sort of last 4 or 5 months, we've also delivered over 3,000 meals to our staff. So the stories, so our next slide, please. I just really wanted to share quickly a few of our stories from some of the groups that we've ran. This is a little bit of feedback first. Thank you for a wonderful session. I quite enjoyed taking out my day-to-day frustrations while kneading the dough. There were lots of smiles at the end and some very tasty cobs. We need more activities like this in the community. There's not enough being offered to support small groups like us. Both our husbands died within 10 days of each other. We're here to help each other, but coming through this as a group has really helped. I think loneliness is a terrible thing, so we can try and get out and make the best effort to see people. And that was from Age UK. Another one around a wellbeing cafe was amazed on how my confidence grew. I never thought I could bake bread that looked like that and taste that good. The session gave me a real sense of achievement, and now I'm looking forward to having a go at home. I enjoyed the experience and it helped me feel more confident. And then finally, the absolute highlight of the day, and this is in Malcolm's words, the absolute highlight of the day was for a guy who'd done drugs for 37 years and been in prison on many occasions. He was very honest and told me that he felt very angry in the morning before we arrived to do the session and didn't really want to be part of the group. By the end of the session, he'd shared so much to the point that I said I felt like I had a new friend. He also left his loaf of bread on the bonnet of a member of staff who in the morning he'd had an argument with in the car park, and he left it with a message on a post-it saying, "Thank you and enjoy your tea." I mean, how lovely was that? So moving on to our next slide. Obviously things have changed in 2020, but our aspirations have stayed the same. We feel these next steps were written as a prophecy, actually, as over the last few months we've established our community kitchen, albeit with one of staff within an NHS building. But we are looking to and can't wait to be out there supporting our patients again. During COVID, during this time, we've not been able to provide any sessions, but we have been there to support staffs in their wobble rooms, doing baking for nurses and frontline workers. So within our 48-hour period, we've recently sort of done some crowdfunding, and we've got a really good relationship now with Marks and Spencer's, who are now donating any food that we can use to run our staff sort of community kitchen. And to date, we've provided over 3,500 meals to staff. We're really starting to get our sessions back online in October, and we'll be doing this through our virtual community and through our recovery college. And then we hope that someday we can soon start to reintroduce our community and our inpatient sessions. Thank you for listening. And as I say, I'm sat up here in the Lake District with my feet up having a glass of wine, but I wish to toast my team, my colleagues and everybody else today, wishing you all the best of luck for a successful afternoon. And that's from Malcolm. So thank you.